On 31 December 2019, there is a cluster of pneumonia cases in Wuhan, China. Some of the early cases had reported visiting or working in seafood and live animal market in Wuhan. Investigations found that the disease caused by a newly discovered novel coronavirus, which was first called in China as 2019 nCoV. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe disease. A novel coronavirus is a new strain that has not been previously identified in humans. The new virus was subsequently named the COVID-19 virus. COVID-19 spread within China and to the rest of the world. And on 30th of January 2020, Dr. Tedros Adhanom Ghebreyesus, World Health Organization Director General, declared the novel coronavirus outbreak a public health emergency of international concern. At that time, there were 98 cases and no deaths in 18 countries outside China. But then, on March 11, 2020, due to the rapid increase in number of cases outside China, World Health Organization Director General announced that the outbreak could be characterized as a pandemic. What is COVID-19? COVID-19 is a disease caused by a virus called SARS-CoV-2. Most people with COVID-19 have mild symptoms, but some people can become severely ill. According to World Health Organization, the most common symptoms of COVID-19 are fever, tiredness, loss of taste or smell, and dry cough. Few patients experience aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Patients usually have mild symptoms that start gradually. Most patients recover without needing any special treatment. Only around 1 of 6 patients manifest with difficult breathing and become seriously ill.
How does COVID-19 spread? COVID-19 is transmitted from person to person via droplets, contact, and vomitus. It is transmitted when one individual talks, sneezes, or cough, producing droplets of saliva containing the COVID-19 virus. These droplets are then inhaled by another person. COVID-19 transmission usually occurs among close contacts, including family members and healthcare workers. It is therefore important to maintain a distance of more than 1 meter away from any person who has respiratory symptoms. But if you would ask, can COVID-19 be caught from a person who has no symptoms but infected? The risk of getting COVID-19 from a person without any sign and symptoms is very low. Remember, COVID-19 is only spread through respiratory droplets coughed by an infected person. Therefore, if an infected person does not cough or talk, he or she most likely will not infect others. However, many infected persons only experience mild symptoms. This is particularly true at the early stage of the disease. It is therefore possible to get COVID-19 from an infected person with mild cough but is not feeling ill.
How dangerous is COVID-19? The World Health Organization says that approximately 80% of those with the virus recover without needing any special treatment, and only 1 in 6 become seriously ill. That's around 15% of cases which are severe, and 5% which are critical. There is a slim chance of being hospitalized with a moderate case unless the individual is really struggling to catch their breath or exceptionally dehydrated. And in severe cases, coronavirus can lead to pneumonia, which is life-threatening. However, government advisors in the UK believe that chances of dying from coronavirus is between 0.5% and 1%. Who is most at risk? Number 1. Anyone over the age of 70, regardless to underlying health conditions. 2. Anyone under 70 with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer. 3. Pregnant women. 4. Anyone taking medication that weakens your immune system.
Good day, I'm Rosalyn Andas, and for today's video, I will discuss to you on how can we protect ourselves from COVID-19. I will tackle 7 steps to lessen the possibility of us acquiring COVID-19. First, wearing your mask. Everyone 2 years and older should wear their mask in public. Wear your mask over your nose and mouth and secure it under your chin. If someone in your household is infected, people in the household should take precautions, including wearing masks to avoid the spread to others. Fit the mask snugly against the side of your face, slipping the loops over your ears, or tying the strings behind your head. And make sure you can breathe easily. Second is to stay 6 feet away from others. When inside your house, avoid contact with people who are sick. If possible, maintain the 6 feet away from the person who is sick. Put a 6 feet distance between yourself and the person you don't live with. Remember to always keep your distance. Third is to avoid crowds and poorly ventilated spaces. Being in a crowd in restaurants, bars, fitness centers, or movie theater will put you at higher risk of getting COVID-19. Is to wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public area. If soap and water is not readily available, make sure to have hand sanitizer or alcohol. Avoid touching your eyes, your nose, and your mouth. The next one is cover coughs and sneezes. If you are wearing your mask, you can cough or sneeze, and after that, you have to change your mask as soon as possible. And don't forget to wash your hands. If you're going to sneeze or cough, make sure to cover it with tissue or handkerchief, and after that, wash your hands immediately. Second to the last is to clean and disinfect. Make sure to clean high-touch surfaces daily. This includes tables, doorknobs, light switches, candles, desk, phones, keyboards, toilets, faucets, and many more. Always make sure to have alcohol or hand sanitizer wherever you go. Last one is to monitor your health daily. We should always be alert about the symptoms. Watch for fever, cough, and shortness of breath and other symptoms. Always check your temperature. Again, that is 7 tips on how can we avoid acquiring COVID-19. Keep safe, everyone.